I've been consultant for 5 years now, and as initially an interest in coding led on to an interest in patient level data and getting costings right, and that was whereas my interest in that and then becoming a lead clinician meant when we had the chance to work with the PLICS team here, we could get a lot of important work done. Discovered some useful ways through what were previously very complex areas, working together with the PLICS team. And as I grew into the role of lead clinician, and I realised how important that was across the whole of the delivery of our service, that these things all began to come together, and we've now got to a point where we can turn things on their head a little bit and look at it from the other end, from the PLICS end, and then work backwards and find out where the problems are, looking at where there's waste in the system and being able to see how expensive things are. And clinicians often are immune to this, and we've, in the past it's like, it doesn't matter how much it costs, we do the right thing. Yes, we do the right thing for patients. Yes, it has to be safe. Yes, it has to be high quality. But when you see how much the waste in the system costs, clinicians, I'm sure, will be more motivated to address that and do what they can to influence change. And I think looking at the whole patient journey from ambulance to A&E to hospital to procedure to discharge to everything else is really important. Again, using the examples of what I do, which is electrophysiology, 5 consultants doing a roughly similar case mix. If one consultant shines out as being markedly more expensive in what they do than another, then that's actually very important information. In reality, what usually happens is you look at most people doing things quite similarly within a centre, but actually finding that someone's doing something which is shining out as a red light, going, okay, well, this is the same results but twice as expensive. What's going on there? Is it kit that's used? Is it coding issues? Is it the transferring of the data and the notes to coding? Is it the time of a procedure? And one thing I really realised, and what I'll come back to probably later, is that in an interventional specialty where you're spending time in a cath lab or an operating theatre, the cost of time is really quite important, which really brings into mind efficiency and waste reduction and reducing the turnaround time between cases, getting as much out of the resources you can, because that resource is valuable, it's not cheap, and it's precious, and we need to make the most of it. So that's the kind of benchmarking in-house. The PLICS, you can activity, you're looking at income generated compared to last year, the year before, and you see things that stand out as wrong, and you can often use that backwards as extremes, looking at things that are really red or really green, opposite ends of the spectrum, and look back to see where the problems lie. There might be that for some reason there was something wrong. There was reduced activity, there was cancellations, there was one operator taking twice as long as another, but it's a really useful tool for doing that in terms of benchmarking as well. I think clinicians are very good at looking at something that doesn't look right, because they have a appreciation of the clinical sense of it. And again, using my own examples, you can see that very quickly. You can see that just something doesn't look right. That shouldn't be that expensive. There's something wrong there. And you drill down to a couple of examples, you realise there was an error in recouping pass-through costs or something. That's what, when all this data is presented, there's things that the finance people can see, and there's things that the costings people will see, but there's other things that the clinical team, myself or usually, can see very quickly that would just not have been evident if a clinician wasn't in the room. And that's why I think the two things have to exist together. You need the clinical input and the costings team input. So top tips for clinicians who want to get involved is, if you've got something that involves money, which is most of what we do, and service change and improving things and making things safer and better and quicker and more efficient, reducing waste, all the things people are genuinely clinically engaged in achieving, ask the PLICS team for help and see what they can offer you. And I think people will be surprised.